Welcome back. We have Dr. Harpreet Lotay joining us from Sona MD. It's great to have you back on the show.
Hi, Susie.
Yes.
Thanks a lot. Yeah, I'm glad to be here again. Yeah.
We're talking today about a new procedure that's designed to rejuvenate the skin. It's called a halo laser.
That's right.
I've not heard of this at all.
Yeah, so I thought it's fall. You know, we've had a great summer, but those UV rays can do a number on our skin.
And the smoke.
And the smoke and all the rest of it. So fall is a great time to sort of refresh the skin and, you know, reset.
Mm-hmm.
Yeah.
So what is this all about? Is it invasive? Is it topical? How does it work?
So the laser is a very unique hybrid laser. That means it uses two different types of wavelengths to improve the skin. It's a fractional laser, and it's, I often say to people, it's sort of like aerating the skin. And for years I've used other lasers, CO2 lasers or erbium lasers, but I found that patients found them uncomfortable and the downtime was difficult for them. You know, they had skin that was unsightly for some time until it healed, and the actual procedure was not enjoyable.
Okay.
So the halo lasers are really great innovation. It's very safe. It's great for wrinkles, pore size, just overall refreshing the skin, improve pigment, as I said, and it's great for all skin types, and that's really what appealed to me, because having a darker skin type myself, a lot of the laser options out there weren't very safe for my skin type, with hyperpigmentation being a potential issue. So as I was searching for options for myself, I came across this very safe laser. It's safe up to African skin types, in fact, which is, you can't say that about many treatments. Yeah.
We have video, so let's take a look at how it works.
Yeah.
What is involved in the treatment? As we're looking at it here, clearly you come in. How long is the commitment here as you're lying down?
You're probably with us for about an hour. It's a 30-minute treatment. We use some numbing cream to make it even more comfortable. And as you can tell, Crystal, our fabulous front office coordinator, is having her treatment. And what I like about it is it really delivers the laser beam very evenly across the skin. And so you get a uniform improvement. And Teresa has a lot of, she's our nurse, and she's had a lot of experience with laser technologies, and she's found it really enjoyable to treat patients because they're comfortable, they get fabulous results, and as a provider, we're not worried at all. We know what we're going to get.
What is that sound we're hearing?
So the energy is delivered in quadrants. So you measure off the amount of skin you're going to treat, and it will deliver the energy evenly across that quadrant and measures it. So it's technically very sophisticated in that way. There's no guessing.
When you leave, is your skin quite red? Is it sensitive? How does that work?
So it's a bit red, and you feel a bit warm for maybe up to 20 minutes to an hour. And then the skin heals over quite quickly, and you're able to apply makeup the next day and go about your day as you would normally. You may get a bit of peeling at about day 3, very much like, say, a chemical peel or something like that. So it's not anything excessive. I've talked to patients who've had experience with some of the older lasers, and they're frankly scared of it.
Right.
And when they experience the halo, it's such a different experience.
Okay.
So little discomfort, and so it's a breeze.
And is this something you do once, or is it something you would do on a sort of a regular basis?
Well, it's so comfortable that some patients have significant improvement and they choose to do it again in a year or two. But when you reset the skin, it really depends on your commitment to maintenance and using sunscreen and doing all the right things. You may not choose to do it again for some time, so it's very personal in that way.
Sure.
Yeah.
We have some before and afters. Let's check those out.
Yeah, so this is an example of a darker skin type patient, and she had some raised lesions called DPN around her, and post-inflammatory hyperpigmentation. So this is her result after one treatment.
It's quite significant.
It is quite significant, yeah. And here's another patient that she didn't like the lines around her mouth, around the jawline, and some of the sagging that we tend to get. So her choice was to go with a laser procedure, and I think she had a great result too.
So this is the halo as well?
It is the halo, yeah.
Yeah, no, you can see a difference, there's no question.
And here's a close-up of something similar. This is a patient that's just 10 days out, so she'll continue to have improvement over the next couple of months. And I will use a combination of fully ablative techniques around some of the deeper wrinkles, and then go over it with the halo. And I've had results that are pretty equivalent to full face resurfacing that in the old days took people down for a month or more.
That's amazing.
Yeah.
Once you've had the treatment, how much time passes before you've sort of seen the optimal effects of the procedure?
I would say 21 to 30 days.
So every day you wake up, you look a little better.
Exactly.
I like that.
Yeah.
It's like a Christmas gift every morning.
Exactly. Yeah, it's been fabulous.
Awesome. So how does one get involved in sort of setting up an appointment? Do you come in for a consult first, or how does that work?
Yeah, we like to have an individualized consult. Because the laser's tunable, we can really gear the treatment towards you. And I always like to make sure you're on the optimal skincare so that we can maintain your results. We don't want you to invest your time and money with us and not get the best result possible. So we want to educate you. We want to make sure you're doing all the right things for your skin. And sometimes we'll have pre-treatment where we say, do this for 6 weeks, get your skin ready to be the best it can be, and then let's do the treatment. So I would come in first.
That's awesome. All right, great. This is something I've never heard of. I think it's great.
Yeah.
A good option for people looking to smooth out their skin, make it glow a little bit more, get rid of imperfections.
Absolutely.
That's a good thing.
Yeah, and you can learn more at our website, always, sonamd.ca, and come in and see us.
Awesome. And that's on the screen right there, sonamd.ca. Dr.
Yeah.
Lotay, thank you for being here today.
Thank you so much, Susan.
You're very welcome. Quick break. We'll be right back. Stay with us.